Let's talk about these health tech companies and how they're collecting all our data from us, and I don't even know if it's really beneficial anymore. A lot of these companies want to empower patients by saying they're giving us the information we need to make better decisions for our health, but at a certain point, I think there's so much information collection that I don't know if it's useful anymore. And then also, I don't think these companies are really protecting our data, which could put us at risk in other ways. If you don't know me, hi, I'm Nadia. I talk about public health and pop culture. Sometimes I combine the two, sometimes I don't. It just depends on how I'm feeling that day. And so, welcome to my channel where I talk about things going on in the world. And this is one of them. So, without further ado, let's get into it. I started wanting to do this video when I saw an article about the company Whoop and how they're collecting people's blood to sort of analyze their biomarkers or something like that. And I just thought it was really weird and invasive. And this is something that they sold as being able to give you the tools to help you figure out what's going on with your health. And I think there's been a trend lately of companies collecting more and more data, even beyond what users actually want. Because they say this is what people want, but I don't really know if that's true. And so I just wanted to talk about that today and how these companies are collecting our data, how they don't really care about our privacy, and essentially what it means for us overall. And I'm talking about this without a script or any notes, so we'll just see how this goes. If it's not coherent, just don't worry about it. One company or product that really falls into this category is Fitbit, which was purchased by Google a few years back now. I don't remember the exact year at this point, but they recently announced that they are overhauling the Fitbit app and replacing it with Google Health, and they're getting rid of a lot of the features that I enjoyed about Fitbit. And so I've had Fitbit for about probably 7 years now. I got the Versa 2 when I graduated from high school, and I got the Sense 2, which is my current watch, when I graduated from Duke. So I'm going on about 3 years with this one. And they essentially made this announcement. They're overhauling the app. They're getting rid of things like badges, which I really enjoyed, which tracked like your achievements over time, like how far you walked, how much you walked. And they're also getting rid of the social community aspects of the app, which is something I didn't use as frequently, but I occasionally use to do like challenges and stuff with my friends. And so they're getting rid of this in favor of allowing people to upload their medical records to the new Google Health app. And I'm like, I didn't ask for this. I didn't want to attach my medical records to my watch. And like I said, I think they're collecting data saying they're going to help people, but this is not something that I want. And I do generally believe in transparency and give people the information and tools that they need to make decisions. But at what point is the amount of information we're gathering actually useful to the person? Because I mainly use my Fitbit for tracking my steps and tracking my sleep. And even that's not something I check like on a daily basis. That's not something I'm bringing to appointments. That's just something I'm interested in doing. And so, like, who is this helping essentially? The issue itself is not the data collection, because I think data can be useful for a variety of things in healthcare and in public health. Like, while I was thinking about this video, I was often thinking about, like, what use could we get out of this information if we actually gave it to, like, public health departments to figure out, like, what's going on in terms of, like, chronic disease management, things like that. Like, I know I skimmed over some research articles where they were talking about how they use, like, wearable device data to track, like, who was getting sick and potentially to track outbreaks and things like that. But I feel like that's not what a lot of these companies are doing. I know some of them do sort of share their technology for research studies, but is that information really getting to the public in a timely, efficient way? I don't know if that's truly what's happening. And then, of course, there's a lot of risk in terms of, like, who sees this data? Like, is it being leaked somewhere? And that's something that has happened a lot with these companies. Another thing I was thinking about was a semi-recent research study that came out of UNC, and I'm not sure if there were other institutions attached to it, but it essentially looked at use of period tracking apps after the fall of Roe versus Wade in 2022 with the Dobbs Supreme Court case, and it actually found that more people started using period tracking apps after Roe versus Wade fell, and this is despite all the privacy warnings about these apps and how it could potentially leak data to other sources. Although, from what I've read of abortion news, a lot of the supposed leaks of data are because someone tipped someone off. Like, I know there was a big case about like Facebook handing over a teenager's private chats about getting an abortion, but that was because someone in the teenager's life reported her. So it's like kind of that intermingling of what are the tech companies up to, and then also what's going on in your personal life, you know? But essentially, people are continuing to use these apps despite the privacy implications. And I do think it comes down to convenience a lot of the times, because I know I definitely kept using period tracking apps just because that's what's convenient for me, even though it may not be the best for my privacy. And I think there's also a sense of thinking like, who would give up my data? Why would anybody care about me? But that's not really protecting me, and I don't think that's a mindset that protects anyone else either. And so I do think these sort of health tech companies do have a responsibility to try and like safeguard people's data, especially because as we get more engulfed in this technologically driven world, I think people are not thinking about what they need to do to protect themselves. And so I think they do have a responsibility to do that. I also think there's kind of a interesting sociological dichotomy in what's going on here, because on one hand you have these tech companies claiming that they want to give people autonomy over their data, and then on the other hand there are some articles coming out about like data that comes out in like patient portals, like test results being sent automatically and things like that, and how doctors are saying, you know, patients are upset about this, maybe we should pull back a bit. Because I don't think we should pull back at all. I don't think that's helpful. And so it's kind of these two-sided thing of maybe paternalism, I would say. It's like, because one's trying to protect patients' emotions by not giving them information, and the other is acting like they're acting in patients' interest by giving them information, but they're also using the information for their own nefarious purposes. An example of this is the semi-recent breast density notification regulations, where if a patient is notified that they have dense breasts, they're supposed to be notified to let them know they may need to get more imaging after a mammogram, etc. And there was a article that came out saying, you know, like patients were like upset and confused by it. They couldn't really figure out how to act on it. And so there was some kind of pushback from physicians around that. But at the same time, I wouldn't say stop telling people that. I think it's a question of tell them what exactly they need to do. And I think that's the bigger answer to all this data collection anyway, because it's like, for collecting the data, what exactly are you going to do with it? If you have biomarkers in your blood or whatever Whoop is testing, what are you supposed to do with that essentially? And I think that decision making is where a lot of these like health AI, health tech companies try to come in. But once again, that goes back to who has my data and what are they doing with it, you know? And the reason I keep talking about health data privacy is because, one, you don't always want your personal stuff out there, for one. And then also just like discrimination, like health discrimination is still a thing, even though there have been policies to try to reduce that. And you don't want your medical records floating around to have someone make choices that are not in your favor for you. And also just people using your data to sell you things. I think that's the big thing for a lot of these companies. They're trying to sell you health, wellness, etc. And it's more for their own profit than for what they say is the intended benefit. Anyway, I think that's all I have for today's video. Let me know your thoughts in the comments, like whether you think these companies are doing a public good by collecting this data to try and empower patients, if you think there need to be more guardrails, what you think about the role public health has in all of this, like whether they need more access to this data, or whether there should be more research studies, etc. There's so much to say about this topic, but yeah, just definitely let me know your thoughts. And if you liked this video, be sure to like, comment, and subscribe, and I will see you all next time. Quick postscript that I forgot to mention is the fact that the US government has also enabled a lot of this. Both current administration and previous administrations, they've really pushed for more interoperability with health data, allowing you to use apps and things like that. And especially the current administration, they're looking for more ways to get access to people's health information. So this is a kind of an ongoing thing at all levels. And even though I talk about the importance of this data to public health, there are data use agreements and privacy agreements in place for a reason. So that's also a component of this.